Let's get a start to our pocket-sized pulse session for today. This is session 2. For those of us who joined us yesterday for the session 1, welcome back again. Today's session, we are going to be focusing on the telemedicine aspect of pulse. And you're going to learn how it works, how it's going to be useful to our customers when we launch the Pulse application to them. We've got a very special guest today. So, you know, the telemedicine functionality on the Pulse app, we've partnered with MyDoc to provide this functionality to the app. So we've got with us today Dr. Matthew Lee, who is the Director of Clinical Operations at MyDoc. Dr. Lee is a public health specialist who is accredited by the Specialist Accreditation Board in Singapore. He has a lot of experience working in different healthcare settings in Singapore, from delivering clinical care in hospital and community clinics to healthcare management and policy making at the national level. So his focus now at MyDoc is to help drive digital transformation in Singapore and the region, with the ultimate goal of bringing value-added healthcare to the patients. So today his topic is going to be respiratory ailments, which I think, you know, many of us during this period will be very keen to hear about, and how you can seek care with telemedicine. Now, just a little note, we'll let Dr. Lee do his presentation, and we'll take questions at the end. There's a little chat function at the bottom of your screen. You can send us those questions as we go through the webinar, and we'll address the hot ones at the end of the session. Right? So let me hand over now to Dr. Lee.
Thank you, Priya, for the introductions. So hi, everyone. It's a pleasure to be here to share with you some of the information regarding Prudential Pulse. I hope every one of you is doing all right at the moment, spending some quality time at home with your family, and also having some rest at home. So we are indeed we are in a very special situations right now, and I think it couldn't be a better time for us to have a Pulse, Prudential Pulse, to go live. Now, today our focus is on two things. So I'll first share with you some of the information regarding the respiratory illness, and the second part, I will just walk through the whole Pulse workflow, and also some of the information and useful tips regarding telemedicine. Now, as you can see here, this is slides to actually illustrate the different types of respiratory illness that you can see right now in Singapore, and what are some of the common symptoms that you can encounter. So, of course, right now in the top of everyone's mind is the COVID-19, which is caused by the novel coronavirus. And based on the data in Singapore, the most common symptoms suffered by COVID-19 patients is actually fever and dry cough. And that happens in about 70 to 80% of the time. And shortness of breath is also common, but this only happens in people who actually suffer the more severe spectrum of disease. 80% of the patients actually suffer a mild disease, but 20% of the COVID-19 patients suffer a more severe disease. And one thing that's very special about COVID-19, which is actually not included in the slides, is this thing about anosmia. It's actually a medical term to describe the loss of the smell and taste sensations. So scientists, the researcher actually discovered this very unique symptoms to COVID-19 in about late February. So that is a symptoms that doesn't happen in other respiratory illness. And that happens in about almost 1/3 of the patients who actually has the COVID-19 virus. So you can see a common cold is the other common types of respiratory illness. Common cold is normally milder compared to flu, and it's also caused by virus such as a rhinovirus. And fever is actually very rare to occur in patients with common cold, and as well as a shortness of breath. Now, apart from common cold is flu. So flu is also caused by virus, caused by the influenza virus. And flu normally happens in the southern hemisphere, and also the northern hemisphere in the countries with 4 seasons. And there is the flu vaccines that you can take to actually prevent you from contracting the disease, or if you do contract the disease, you actually suffer milder forms in terms of the symptom severity. Now, the flu also differentiates itself from COVID-19. Flu is actually less contagious compared to COVID-19, and normally less severe compared to COVID-19. And there's a vaccine for flu, but there's no vaccines for COVID-19. COVID-19 is at least 10 times more severe than flu in terms of the symptom severity and also the mortality. So apart from that, one thing that's very a difference in between the flu and COVID-19 is for flu virus, it actually affects people who are elderly, above 65 years old, and also those who have chronic disease conditions, pregnant women, and also children below the age of 5. Whereas for COVID-19, as you are aware, it mainly affects people who are above 65 years old and those with underlying chronic conditions. As for children, it is very rare for them to have a very severe disease in children for COVID-19 as compared to the flu virus. Now, the last one on the right is the allergies. So allergies, you don't normally get fever in the allergies conditions. And one form of allergy is the hay fever, which can be triggered by dust, or it can be triggered by pollens. It's a more severe form of allergies where you can get something that is more generalized. You can get like some itchiness, you can eye itchiness, skin rashes, and also sometimes you do get cough from that kind of allergies as well, which is quite common in countries with 4 seasons. But in Singapore, flu and common cold is the more common types of situations that we encounter on the telemedicine platforms. Next. So Prudential has partnered MyDoc to actually create telemedicine platforms that's available on the Pulse app, which you can download with the QR code that was shown to you just now. So what you are seeing here in this slide is actually the homepage of Pulse, and there are a series of services that you can access on the front page. You can see there is you can access the health risk assessments, you can access the symptom checker, and you can access teleconsultations, which is the button need a doctor, get a video consultations. There's a button for teleconsultations. And after all, you can get yourself personalized healthcare records under the consultation summary. Now, telemedicine's been around for a while, and it has gained massive popularity in US, in United States, been around for more than 10 years, and it has gained a lot of tractions in Asia, especially in Singapore. Singapore, in fact, is at the forefront of a lot of countries in Asia. We have a regulatory sandbox program where the MOH actually work very closely with providers like us for them to understand the teleconsultations landscape on the ground and how we carry out the teleconsultations. And most importantly, we work very closely to ensure that the industry standards, the care standards, and patient safety are always maintained in teleconsultations. Now, in fact, for Prudential, Pulse, it cannot come at a better time. You know, when we are in this circuit breaker, everyone is advised to not step out of their house. People are working from home. Children are actually learning from home. Having this very important tools, it's actually help people to access healthcare in a very timely manner without the need to step out of the house. Now, telemedicine is actually a tool in the fight against COVID-19 outbreak. So with telemedicine, patients who actually suffer from respiratory illness when it is when you just started to have the symptoms, 1 day, 2 days, or if not 3 days, and the symptom is not severe. And this is actually a very good platforms for you to actually access doctors to prevent you from actually going down to a physical clinics. So in this period, you're advisable to stay home as much as possible. So patients, when they want to travel to a brick and mortar clinics, they probably have to take a public transport, they probably have to go through some neighborhoods, walk in a shopping mall. So they actually expose themselves to the people around them. So if the patients do carry some kind of virus, there is a risk for the patients, for the person to actually spread the virus to the members of public, or might even spread to a healthcare personnel. And if the person doesn't have any virus, or if the person doesn't have COVID-19 virus or the coronavirus, going out actually expose the person to the risk of contracting the virus. So by giving patients these options to consult doctors at the comfort of their home, we are actually breaking the chain of transmissions. That is very crucial in the fight against COVID-19. So apart from this, for our normal illnesses or any like chronic conditions, sometimes patients procrastinate, don't want to walk down to a physical clinics, and procrastinate, prevent the delay seeking care, and that might have an impact in their health. But by having this pulse available to the members of public or to the policyholders, we are actually encouraging them to seek care there and then in a very timely manner to avoid any delay in treatments, which might have very severe consequences. Now, that is, excuse me. So that is the benefits of using telemedicine, especially in these outbreak situations. Now, as part of the workflow validated and verified by Ministry of Health, it's very important for us to maintain the quality of care. So we actually have a workflow for patients when they join the platforms, when they want to seek care with our doctors. They actually have to go through a series of triage questions or screening questions to actually, for the doctors to better understand their patients and also understand their risk status, especially in this day and age. Next. So coming back to the second part of my webinar is actually to bring you through the workflow on the pulse. So you can see here, this is a snapshot of the the pulse workflow. The one on the left, you can see that's the landing page. When you go to the Pulse app, these are the services that's available to you. So you can pick a doctor to speak to a MyDoc doctor. And the next screen is actually to inform you that all the doctors that's providing care to you, they are actually Singapore registered doctors, because telemedicine actually break down the barrier of accessibilities. So there is also a possibility where a patient can talk to a doctors in UK or United States. But for Pulse, all our doctors are Singapore registered doctors. And we have a very close working relationships with Ministry of Health. So you can click continue to proceed to the next steps. So as I mentioned, when you first try to use the service, you'll be prompted with triage information. As you can see in the screen or on the first right, there is a list of symptoms. So these are the symptoms that we consider as emergency symptoms. So telemedicine has its limitations. It is not for emergency situations, things like choking, breathing difficulties, chest pain, or someone who lost consciousness. So if you have any of the symptoms, the right approach is actually for you to go to the nearest hospital or actually call an ambulance. So you actually do need to click yes or none of the above for you to proceed with the service. if you do click none of the above, then you'll be prompted with a link to go to your nearest hospitals. It will show you the addresses, where's the nearest hospital. In order for you to proceed, you have to select yes, that you do not have any of these emergency symptoms. Next. And then followed by that, it's a page that you are required to key in your medical information. So this is same as what happens when you attend physical clinics. So at the receptions, the clinic assistants will actually ask you for all this information, your personal information. So the same thing happened here. So these are very important for the doctors to make a medical assessments and also treatments. Things like allergies, any existing medications, any existing medical conditions you have or medications that you are taking, and also the emergency contact persons and the emergency contact number. So these are all mandatory information, and then after that you will actually proceed to the payment page that you have to put in the credit card details, the payment details before you proceed with the consultations. But the fees will be charged after the consultations. Next. So once you are done with that, then you'll be prompted with 3 questions. So this is the screening questions. The bot will actually ask you what kind of symptoms or issues you are facing today, and what is the durations of these issues or these symptoms, and also any further details that you want your doctor to know. And this information, once you key in, will be transferred to a doctor, and the bot at the back end will actually search for the doctor who is available, so that they will give you the earliest possible appointment time. And once that is confirmed, you will have the information. You will see that in the media screens, where you can see the details of the doctors and also the details of your appointment. And nearing to the time of the appointment, the doctor will join the call, and then you will join the call. You will click the button "Join Call," and you will start the video consultation with your doctor. As you can see on the screen on the right, it is just like your standard FaceTime format, where you can see your doctor and the doctor can see you. The doctor will actually do a series of examinations. The doctor will actually take history from you to get more information of your symptoms. The doctor might also examine you. For example, having that might require you to open your mouth, to look into your throat, do some kind of assessments. And if you for patients with chronic conditions, doctor may also ask them for readings like blood pressure readings, diabetes, blood sugar readings, and also might also ask for heart rate, respiratory rates, and also our temperature, especially for respiratory illness. Next. So in addition to all this, we have the whole suite of the services. We are able to give you medical certificates, the digital medical certificates. So that will be sent to you in-app, and you can access the medical certificates under the My File sections, as you can see in the middle screen. And then in addition to the medical certificates, there are also other documents that our doctors are able to give you on the platforms, such as prescriptions and also referral letter. So this is a summary of the documents and also your consultations with your doctor. Next. So this is an example of the medical certificates. On the left, the medical certificates will actually comprise doctor's details, the clinic details, and also your personal details and the durations of the medical leave. Now on the right is a copy of the digital prescriptions. Do take note that this is actually a copy for you to have to keep a record. This is actually not for you to actually present this at a pharmacy for the fulfillment of medications, because the original copy of this digital prescription will be sent to a clinic or a pharmacy for dispensing. So this one that you see here is actually a watermark. It actually specify that this is not for dispensing. This is only for record purposes. Yep, next. Now, once the consultation with the doctor has finished, our concierge will actually take over. The role of the concierge in this case is actually to coordinate the medication dispensing and also the medication delivery. So you'll be talking to a person, and they will get more information from you. They will ask you whether you are the person who's collecting the medications, or it is actually someone else that's collecting on your behalf. And also, where do you want these medications to be delivered to? So it's a very user-friendly service. And as the screen on the right, it actually show you the summary of your consultation history, your doctor's informations, and also all the documents that you have received from doctors. And also, I want to highlight that the Pulse platform is also allows you to upload files or information to the doctor. So, for example, if you have a picture of your rashes, if you do snap a picture of your rashes, or you have a health screening report or any X-ray report, you can actually upload and transfer it to your doctors for doctors to take a look. Yep. So next. Right, so I've come to the end of my webinar. So the next sessions I'll hand over to Priya.
Thanks so much, Dr. Lee, for your presentation. I hope our viewers now have a better idea of what the telemedicine function within Pulse, how it works and how it functions, and how it can actually help people seek care really from the comfort of their home for certain conditions. Now, Dr. Lee, I have one question for you. The doctors who are going to be doing the telemedicine consultation, who are these doctors?
So based on our arrangements, with Ministry of Health, all our doctors that's providing service on Pulse, they are all Singapore registered doctors. And internally, we have certain measures to ensure the quality. So one of it is they have to have at least 3 years of relevant experience, be in a hospital or the clinic settings. And they will have to go through MyDoc onboarding and also MyDoc training sessions. Only those who qualify are allowed to deliver the service on the Pulse platform. Yeah.
Okay, thanks, Dr. Lee. There is another question on whether or not Pulse is actually tied up with our PruPanel Connect, and maybe I'll toss that question to Dr. Siddharth, who is head of our medical team at Prudential. Dr. Siddharth, can you take that question, please?
Yeah, sure, Priya, will do. Thank you. So what's going to happen is this: in this healthcare journey, once there is a teleconsultation where a GP from MyDoc decides that the condition of the patient is such that there's a need to refer to a specialist, then of course they would be referring to a specialist who is under PruPanel Connect, that is Prudential's panel of specialists. Having said that, those specialists who at their clinic have a facility of providing telemedicine or teleconsultation services, the policyholder or the particular patient can actually avail those services. But there could be specialists who do not have these facilities in their clinic. So it's about which of these specialists could have these facilities available at their clinic once the MyDoc doctor recommends a particular specialist.
Okay, thanks, Dr. Siddharth. Dr. Lee, there are some practical questions I think that are coming in about telemedicine. So someone's asking if they need to take their blood pressure as part of this consultation, right? How do things like that work when you're doing it over a screen?
So that is a very good question. In fact, on a broader scale of things, we are looking at things like things like Internet of Things. So your Fitbits or your Samsung exercise app that count your footsteps, all this. So these are all part of Internet of Things, and blood pressure machines. Some of it also has the functions of actually being connected to a device. So these are some of the things that we are looking for that might happen in the future. I mean, of course, it will happen, but it's just a matter of time in the future. But coming back to now, in terms of how to measure blood pressure, a lot of people with chronic disease conditions and high blood pressure, they are encouraged to measure their blood pressure on a very regular basis to monitor, to make sure that it stays within the range if they are on medications. And so for people who use the Pulse app and people also have hypertension or high blood pressure, it's advisable that they have their own sets of blood pressure machines at home, and then they can record as advised by their normal brick and mortar clinics GP, and then record the number. So when they seek care with our doctors, they can inform our doctors in terms of how their blood pressure is doing in terms of the trends, so that we can monitor, and then we can adjust the dose accordingly. And if everything is stable, we are also able to just replenish their medications and have it delivered to them. Yeah, but I think one thing to take note is actually if you do have a blood pressure machine at home, it is very important for you to make sure that it is calibrated on a very regular basis. So one of the way to do that is you measure, and then you bring the blood pressure machine at home, and then you go to a brick and mortar clinics, and you try to check whether the readings with the clinics are the same to make sure it is accurate. Thanks.
Okay. So might be good to have your own little blood pressure medicine at home, machine at home, if you kind of regularly use the service.
Yeah.
Okay, great. Dr. Siddharth, I have a question for you now, and it's on the overall app. First question is, can the app be shared by family members, or how is the app registered? Is it on an individual level? And secondly, is this suitable for children to use? What's kind of the age limit we're looking at?
Okay, so thanks, Priya. I think to answer let me first answer the second question. So this app has been developed keeping in mind the epidemiology data of Singapore, where we have taken the risk factors, the incidence rates, et cetera, and all this has been done for age groups 18 and above. So, so this app cannot be used for people who are or children. Sorry. Secondly, the other group of people who cannot benefit from this app is pregnant women, or for the simple reason that it's a very normal physiological thing to have health complications during pregnancy, and therefore that is not considered as a part of general standardized data. So that is also the set of people that will not be covered under this app. So it's children below 18 and females who are pregnant. So that's part two of the question. Coming back to part one, you see this app, when it's downloaded and the registration happens, it happens for a specific individual. So at the back end, what goes into the algorithm is the age, the gender, so on and so forth. So therefore, the same app with the registration of, let's say a male aged 40 years, and then if, I'm sorry, if there is a child using that, okay, not a child, let's say somebody who's 19 years, female, so the symptoms they might be putting in might actually not match with the gender and the age of what's been registered, because from the assumption that at the back end there's a graphic model that's in place that does all the symptom checking and the health check, it would really sort of not throw out the correct results. So it's advisable that everybody who is using the app should actually have registered their own actual height, weight, gender, age, any other comorbidities, that means any other ailments they might have for the app. And mind you, this is a healthcare journey end to end. So it's very important to input the correct information, because there's a health check component there, there's a symptom checker component there, there's a digital twin component there, and there's a telemedicine component there. So for all these components, the actual person's detail have to be captured properly. Thank you.
Okay, thanks. Thanks so much. Dr. Lee, is this, are the doctors on the panel, so there's a question again now about doctors on the panel, are they tied up with the MHC panels?
Yeah, the short answer is no. Yeah.
Okay, all right, thank you.
Yeah.
Let's see what other questions we can take now. Dr. Lee, you know, telemedicine is still a little bit new, I would say, in Singapore, right? And so some people may be a bit hesitant to use such a service. Like, what can you tell people to kind of reassure them that, hey, this is something that is really beneficial and really convenient? You know, some of the older folk may have some reservations about using it.
So that is a very good question. So of course, it is something that is new. I mean, it's new in Singapore, but it's not new in countries like the US, being around for more than 10 years. Now, one of the prerequisites criteria for someone to actually use telemedicine is the person's, first of all, must be at least know how to operate, a Pulse app, or know how to operate a keypad, all this. So I think that's a bare minimum. Now, in terms of whether the conditions is suitable, all this, yes, that's very relevant. For telemedicine, of course, it is not like a one-size-fits-all kind of solutions. Of course, there's limitations to telemedicine. That's why we have the very strict triage criteria that we list down all the emergency symptoms. So that's one level. And if you do suffer from a certain conditions and it's been around for a long time, for example, you have this cough, this fever that doesn't resolve for more than a week, then you can still use our app. But most likely, what our doctors will tell you is to advise you to attend physical clinics for more thorough kind of examinations. Secondly is if you think your symptoms is very severe, sometimes you suffer from very crucial, like pain, severe pain, all this. That's also part of emergency symptoms where you shouldn't seek care on the platforms. And another condition is if there is a strong need for physical examinations, then our doctors will also refer you to a physical clinic. So our doctors actually do have a set of standards and guidelines that they have to follow when they practice on the platforms. Yeah.
And is the telemedicine service available 24/7?
Yeah, it is.
It is. And are there any TCM doctors on the panel to see, or is it GP?
Right now, it's only GP. So that is a very interesting question. Today, you can't access TCM doctors for now, but we are actually working with TCM providers, a big one, and the options will be available in the very near future. Yeah.
Okay, great. I'm going to take one last question, and the question is about how the data that we capture inside the Pulse app, how that is going to be used. Dr. Siddharth, would you like to take that question?
Yeah, sure, Priya, will do. Thanks. So just to clarify again, at the beginning of this journey, there are disclaimers that are there in the app. The app clearly defines the terms and conditions of how the data is going to be used, what's the end purpose of this data. However, for the sake of clarity, the data is not going to be used for anything else except for understanding the health condition of the particular user and help the doctor or help the patient to better understand their health. Beyond that, there is no further use of the data, and it's not going to be used for any other purpose except for seeking either medical help or understanding the health check or basically understanding the symptoms. So it's purely for medical usage. Thanks.
And what about if a customer gives marketing consent for us to be able to contact them? Will we then be able to use their?
Yes, if they have specifically approved and selected the consent box or the consent form, then only probably they would be contacted, but otherwise no. If in case the customer has allowed us to do so. But the data is, to be more specific, the data is not going to be used for any underwriting purpose, any exclusion purpose, so on and so forth. So there's no selection criteria that will be there from this data.
All right. Thanks so much. I think that's all the time we have for today on our Pocket Size Pulse session. So I want to thank all our panelists. So a big thank you to Dr. Lee for taking us through everything we need to know about telemedicine. Thanks also to Dr. Siddharth for joining us on the Q&A. I know some of you may have some questions yourselves about downloading the app, or you may have run into some difficulties with registration. If you have any such questions, please refer to the contact information that you see in front of you right now. So you can call this number, you can email our team here, and they can respond to you. At the end of the session, what we've recorded it, so we're going to be sharing it more widely so you can listen to it again if you want to. So we'll share that, we'll share the link with you. We'll also have some FAQs and loads of other material for you to read through as well. So you're well prepared when you want to go and talk to your customers about the Pulse application. All right, so that's all the time we have today. Take care, everybody. We'll see you for the third session. We've got one more coming up next week. We'll send the message out to you very soon so that you can register for that one, and that will be on engaging your customers with Pulse. All right, take care, everyone. Download the app. Bye.